Two. This is our breakout session on surveillance and detection mechanisms. I'm really honored that you're joining us. And before we go into the discussion, I give everybody an opportunity to introduce themselves. So I'll go along my screen. Irene.
Hello, everyone. I'm Irene Zagoraraki, Associate Professor of Environmental Engineering at Michigan State University.
Thank you, Irene. Julie.
Hello, everyone. I'm Julie Fischer. I'm the Senior Technical Advisor for Global Health at CRDF Global.
Thank you. Mark?
Hi, I'm Mark Smolinski, the President of Ending Pandemics in San Francisco.
Thank you, Jonathan.
Yes, hi everyone. My name is Jonathan Sleeman. I'm the Center Director with the U.S. Geological Survey's National Wildlife Health Center. Thank you.
Thank you, Ben.
Hi, I'm Ben Beard. I'm Deputy Director of CDC's Division of Vector-Borne Diseases in Fort Collins, Colorado, and I'm currently on detail to COVID as the ADS for the Data Analytics and Visualization Task Force. Thanks.
My old home. Thank you, Ben. Casey.
Hi, everyone. I'm Casey Barton Behravesh. I'm the Director of the One Health Office at CDC in Atlanta.
Thank you. And John?
Hello, I'm John Amwesi. I sit in Kumasi, Ghana, where I lead the Global Health Infectious Diseases Research Group, doing a bunch of things, wearing a couple of hats. So it's really a great pleasure to be with you the rest of this evening here. Yep.
And I had a message, but Tracey, you're joining us as well? No? Okay. So you're muted.
Okay. Yeah, I'm sorry. I couldn't share my video and I was unmuted.
Okay.
Tracey McNamara, Professor of Pathology, Western University of Health Sciences College of Veterinary Medicine.
Thank you very much. Is there anyone I'm forgetting that's not on the NAS team that I need to introduce? If not, our task is to come up with short-term, one or two short-term goals, one or two long-term goals, but particularly some key actions and relevant institutions who need to be involved. As I listen to, related to surveillance and detection mechanism, as I listened to this morning's presentations, a couple of things were very clear to me. One, that what really was discussed by John and the other speakers is that we haven't invested in the public health infrastructure. And in my days at CDC, there were three components there. Workforce, and that came up from a student's question, both qualitatively, what should workforce competence be? Quantitatively, how many of those we need? Second, also came up the issue of organizational capacity. Are the actors really, do they really have the capacity to execute, to operationalize what we're coming up with? And thirdly, and that came up big towards the end of this morning session, is on data science. What do we do with knowledge management? The other thing that came up this morning too, that is relevant to our session on surveillance and detection, is the issue of preparedness. How do we invest in preparedness versus the investment in response? And so how can surveillance and detection strategies help us to be more on the preparedness side than on the response side? And then the last piece I've heard that is relevant to our discussion is how can surveillance and detection really help us sharpen our decision tools, so that we can make those decisions not only better, science-wise, but earlier. And so it's in that broader rubric that I just want to open up and talk about what, I always use in terms of, instead of goals, I use strategic imperatives. So as a term. So what are some one or two short-term strategic imperatives, given this framing, that we should undertake? And what are some one or two long-term strategic imperatives? And then for each of those, who needs to act and what are some incentives to act? So a big agenda for 30 minutes, please. thoughts? Julie.
Thank you, Maureen. I'd be happy to start with just a framing proposition. I think from everything we've heard today and from the case studies from recent outbreaks, including the current pandemic, there are two major challenges. The first is the quality of data available at the local level for understanding the situation in terms of priority diseases and disease outbreaks. And that includes the availability of reliable diagnostic testing and the integration of that information into local surveillance systems and the capabilities at the local level to collect and report information for surveillance and data for surveillance up to levels for decision making. And we can talk a lot about the sources of that data and what we do about the quality of that, but local data quality and the platforms for reporting it rapidly is a consideration. And then I think the second issue that seemed very clear was that we need to do a better job with data tools at the higher level for understanding the correlation between data markers and synthesizing those to recognize priority events and start the decision-making process of assessing those events, looking at the risks and communicating across all of the relevant sectors and levels. So I think what I've heard from all of our discussions over this workshop is the question of the quality of data at the local level, and then using that data for decision making more effectively at the higher level, which requires just one more thought, understanding where people are absolutely critical to the system and the points at which we can do a better job using existing data tools and tools that could be adapted and developed to help recognize signal out of masses of data more quickly than humans can do it. So where do we need people in the system? Where are they absolutely critical?
Yeah, well framed, Julie. I think that goes to that combination of what I mentioned, the three areas of who needs to do what, do they need to know, is the local level ready for them to collect and analyze, and what do we do with the data? But I would be remiss to mention, Mark reminded me of that in our previous meeting, is that let's not forget this is about One Health. And the One Health surveillance and detection. And so how we integrate, not only from the human health perspective, public health perspective, but how we integrate animal surveillance with human surveillance for decision making. I think that's really key. Thank you. Other thoughts? Yes, Tracey.
Well, as we're talking about data, I think it's critical to recognize that real-time veterinary epidemiologic surveillance does not exist. Some of the data you want is not accessible. You can't access it. And, if early detection of emerging infectious diseases, emerging zoonoses is based on surveillance, we need to take a species neutral approach to surveillance. We have to recognize that really the only animals under robust surveillance in the US and most other parts of the world are agricultural species, not wildlife, and not all the species that fall outside of the jurisdiction of any government agencies, like dogs and cats and zoo animals with COVID-19. But I think there is a way forward if you wanted an achievable objective in the next 2 or 3 years. I doubt local or state health departments or even the CDC have the IT platforms that allow them, that use natural language processing, artificial intelligence, machine learning, anomaly detection algorithms, or the ability to harmonize unconventional data sources like Twitter, Facebook, because a lot of these things are not going to come from some physician reporting something to a health department. If you want really early warning, you have to be looking for different signals. And I don't think our existing public health systems can capture that. The system I just described may not exist in public health or in veterinary medicine, but it exists in the Department of Defense. DTRA, the Defense Threat Reduction Agency, paid to create this prototype. Well, let's fix it. Let's finish it. Let's make it work and get it out there. I mean, a lot of money was spent on this. We need to close that loop. They've done a huge amount of work on this, and we need to somehow transfer that work to the sectors that need to actually use it to be able to do surveillance.
This is great discussion because it begins to migrate us to which institutions should collaborate. Other thoughts?
Yes, if I can build upon what Tracey mentioned, and I'm going to be a little bit more explicit, I think, in that I think one of our weakest points in a One Health surveillance system is our surveillance in wildlife. The capabilities to collect the samples, to collect the data, just simply don't exist in many countries or in very nascent stages of development. So I think that's going to be a key sector to engage in these surveillance, the environmental sector, the natural resources sector, ensuring that we have the boots on the ground that can collect the data, collect the samples onto wildlife species. And then as others mentioned, making sure that gets integrated into the other surveillance streams. So for me, and I recognize it's a little biased, but to me, that's a critical gap in our infrastructure. Over.
Thank you. John?
Thanks for that. I just wanted to add a little bit to what colleagues have already said, and particularly in places where there is data and just how reliable that data is problematic, because you're translating this data to major decision making. The data on, let's say even just COVID, numbers of cases and mortality is what's being used to inform vaccination plans. I did mention that Ghana got the first doses of the COVAX just yesterday, the first country in the world. But if you look at the numbers of cases in Ghana, upwards of 35,000 plus, and you look just at Burkina Faso to the north and Cote d'Ivoire to the west, and then Togo to the east, they have less than even less than 1/10 in some cases of what Ghana has. It's practically impossible that they have that low number of cases, and yet they all surround one country. It's just about how we go about collecting data. And if you look at the case fatality rate, much lower in Ghana, almost twice the case fatality rate, say in Burkina Faso. It just tells you that the data is not reliable. One may argue that the Ghana data is better than the others, but the truth is that it's still not good enough to inform really, and these decisions have money backing them. Look at a situation like malaria. If you look at the malaria figures for 2020, moving into 2021, it's like malaria disappeared. Of course it didn't disappear. It's just that no data was being collected. So we face a real challenge, and these are several dollar signs behind these policies. How can we make these policies with data that is either absent or totally unreliable? We need to grapple with this.
Thank you. So Irene and then Mark. Irene.
Thank you, Maureen. I'd like to add a few thoughts to what Mr. Jonathan Sleeman mentioned about environmental surveillance. My thought here is that with such a complex problem as outbreak detection and prevention, we need surveillance and data management at different levels. So of course, it's absolutely critical to do clinical testing of humans and animals at an individual level for obvious reasons. That's very critical. But I'd like to also emphasize that I think community composite sampling in terms of in the environment might be an additional option. And in urban areas, for example, a sample that may indicate the population of the community, the infection levels of the communities is wastewater. And in rural areas where centralized wastewater collection is not there, it might be some critical locations in the environment, in the watershed, some particular sub-watersheds, soils and waters where you can, if you collect samples at critical locations and at critical times, you can capture the infections that may be circulating in the human population and wildlife population and livestock. And to do that and organize those efforts in rural and urban areas, in terms of agencies, the USGS might be important to be involved in addition to CDC, and then also at the here in the US at the national, the state level, the departments of the environment, like the Department of Natural Resources, or there's different names for the state agencies that deal with those issues, in collaboration with the public health labs and universities, would help and then also multidisciplinary. It's a multidisciplinary field. So in those agencies, in addition to physicians and scientists and engineers, to identify those locations and times we need to go out for surveillance.
I'm monitoring the time, and we haven't
Thank you.
established any goals yet. And so we have to report in 10 minutes.
I
So
have
we
another
know
goal.
that Mark and Ben and Tracy had their hands up. Then we really need to summarize. And so I think our entire discussion has focused on data, and that's okay. Mark.
Okay, well, mine won't focus on data. Thank you very much, and it's good to see everybody. So our approach at ending pandemics is really, and our work is mainly in low and middle income countries. And I am reflecting on conversations both the first day, the second day, and today, where people are saying we should be learning more from these other countries. The realities are we're able to innovate in some of these other countries because they haven't created these siloed, locked up, empires of human animal environment that we see in some of the developed countries, and they're much more open. And what's been really exciting is to do participatory surveillance, which in my opinion is the way we're really going to get into One Health. So in countries that we're working in, these are the farmers, the market workers, people who have high contact with animals. You heard yesterday from Ezra, working with the Maasai community. If we start thinking about engaging the public directly in the areas where One Health is not a concept, it's reality. Humans, animals, the environment are impacting their health every single day in a way that sometimes I don't think people in the United States can appreciate. But when you engage populations in countries that are hotspots, in Thailand, they are reporting water, food safety, animal die-offs, both livestock, wildlife. They're identifying animal illnesses before there's even a human case. This is the future of public health. And not only is this helpful in surveillance, which is our breakout session of early detection and surveillance, we fully believe that engaging the community directly, speeds response, because you can immediately be giving direction to populations because they've been engaged in a surveillance. And we firmly believe that forecasting and prediction, which is another breakout session, is going to be advanced when we think about getting that data from the community directly.
So I have to deliver in a bit. So in like 10 minutes. And so I know there are several hands up. So if we can together think about, given the discussion we had, a short-term goal for the hands that are up, a short-term goal.
I'll give you one. Regarding what Irene was saying about the environment and all that, like I said, I think we have from surveillance, the IT platforms are there. We just need to finish them, get them out. From surveillance, we now have metagenomic diagnostics that work again, they're species neutral, human, animal, environment. I know a researcher in Jonathan's lab, National Wildlife Health Center, is working with the National Animal Health Lab networks to validate the Illumina and the nanopore MinION platforms. So they're developing standard operating procedures. So if that technology is used in any lab, you can actually believe the results. I asked him when it might be done, because he's working with the National Animal Health Lab network, and when it's validated, it'll get into all those labs. And he said, well, about a year. I'm like, well, why so long? Well, he needs 2 grad students. It would go a lot faster if he had 2 grad students. We're spending $1 trillion on COVID. Give USGS 2 grad students, get on with it. Let's validate those diagnostics for wildlife. It would be applicable globally. That's low-hanging fruit. That could be done immediately. And the other thing I just want to mention, what Mark was saying about the entrenched silos in the US. It is easier to do One Health overseas. It's almost insurmountable here. But, in the US, we talk about a whole of government approach. And a lot of this meeting has been on government finding pandemic threats. Like, well, what about a whole of nation approach? In the US, we know the feds have no interest in dogs or cats. That's okay. Let's get real. Let's admit that. But
I think you have disagreement there. We have got to move on. So Ben, a short-term goal or a long-term goal?
Well, I think just to build on that a little bit with metagenomics, CDC has the PulseNet program, and I think that what you're talking about in animals is something that's very similar and parallel maybe to the program that's used among state health departments to identify and link single source outbreaks and things like that. I mean, that's a metagenomics platform, and that could be coordinated with such as systems with in other agencies, with the animal sector, and I'll stop with that. I know we're running out of time, but
yeah, we are, and they're going to boot us out. So Jonathan, Casey, and then Julie. Short-term goal or long-term goal?
So short-term goal, I think the simplest thing for the next step is to create some sort of One Health surveillance governance structure. Bring together the parties that are currently conducting surveillance and generating data that's relevant to these efforts into an overall governance structure where we can actually start to build the trust necessary to work across these different sectors, as well as actually start to see what current data already exists. Obviously, long-term goal then is to actually create a truly integrative surveillance system using all the different smart techniques that people have described, that's pulling all the relevant data necessary for us to make effective management decisions, including, I think, some of the really neat remote sensing techniques that are coming down the line, as well as use of artificial intelligence and machine learning that was mentioned throughout the workshop. Thanks.
Perfect, thank you. Julie, and then Casey.
So I think for the short term, we've heard a lot about mobile data platforms that have been tested in multiple environments and how effective they can be. I think as we are thinking about building capacities for disease surveillance, we have to go ahead and quit looking passively at the quality of data that's on the ground and accepting that that's what's there. We have to think about building out the reach of mobile networks and using systems for collecting data, whether it's from health, structured health systems or from participatory surveillance programs, making sure that we have the reach with the mobile tools that have been tested, that we know work when they are in people's hands, and make sure that we think about getting the infrastructure for supporting those mobile tools into the places where it's needed as part of capacity building. And then long-term, I think also thinking about integrating sequencing and some of the approaches that have been discussed here today for whole genome sequencing and other molecular epidemiology techniques as part of mainstream capacity building for disease detection in the long term, because that also is fragmented even among high income countries. And we need to start thinking about that as deliberately part of our sources of information to support disease surveillance.
Great. Let me recognize Casey as one of the organizers of our whole workshop, and your leadership was critical. Casey.
Thank you very much. And in line with what Dr. Sleeman was saying, there are a number of surveillance systems that are out there across the different sectors. As a short-term goal, we could work to identify and link those as a start. But as a long-term goal, our U.S. Department of Agriculture is working to develop a national list of reportable animal diseases, and that's something that's in progress. And I think it'd be critically important to have those One Health conversations early as that's being framed. And I will also add that the federal government does address and care about companion animals. We've actually been doing quite a bit of work in that space at CDC, including with the COVID-19 response, and along with wildlife. Companion animals are one of those neglected categories of animals that we really need to pay attention to, because they're the ones in people's faces and people's beds and spending large amounts of time with them during the day. Thanks.
Great. So we have a set of short-term goals and a set of long-term goals. So let me make sure I have those correct. Short-term goals include having a One Health surveillance system, bringing together existing surveillance systems, but connected to that is a long-term goal of integrating those surveillance data. Sorry. The short-term goal is to look at mobile data platforms and existing data platforms and really embrace the notion of participatory surveillance. Long-term, looking at integrating sequencing and using molecular epi as a mainstay. Also, the opportunity to be innovative in places where we are not hindered so much by the existing silos, and that LMICs give us an opportunity to do so. communication is key, and that we've heard from from several of you, and looking at how do we begin to work across the sectors and create a level of trust so that we can share data and we can operationalize data. Julie started also where we can operationalize data at the local level for decision making. What am I missing?
I just think that public health is implemented at local levels, like you said, and I think we need to keep that in mind. And that's true for seasonal West Nile outbreaks and for COVID vaccine rollout. It is so different from one location to the next. And we just have to keep that in mind. And also the communications challenges. Implementation won't be successful if we don't address, public communications, whether it's people against vaccines or people that don't want aerial insecticide sprayed or anything else. There's a huge information issue, the social dilemma, so to speak. If you've seen that video, is very concerning.
Good. So I think in a second they're going to pull us out, but before that second arrives, we talked a bit about key actions. We talked a bit about relevant institutions, but a bit more about that. I mean, we've heard the local level government and the private sector. We've heard USDA, but we've heard DITRA and the Department of Defense. But who would really be the key